Hello everyone, welcome back to the channel. In this video, we're going to talk about 10 of the most important muscles in your body. And what happens if those muscles are injured, or what happens if they don't work properly. So by the end of this video, you'll have an idea of what some of the most important muscles are in our body and how they actually function. And before we get into that, please support us by liking this video and subscribing to the channel so you can be notified every time we upload a new video. Number 10, the trapezius. The trapezius originates from the medial third of the occipital ridge, along the spinous processes of C7 through T3, and the medial border of the scapula from the base of the neck to the mid-thoracic region. It inserts on the medial border of the scapula and the clavicle and the acromion and the spine of the scapula. So it has multiple origins, but essentially the muscle itself is pretty big. It covers a large area of the back of your upper back and your neck. The traps are a superficial muscle, meaning it's one of the top muscles in your back. They function to move the scapula, so any movement of the scapula, whether it's protraction, retraction, depression, elevation, upward rotation, or downward rotation, the trapezius muscle is going to be involved in those movements. So those are the primary actions of the trapezius, just scapular movements. But when you're doing things like shrugging your shoulders or even nodding your head, you're using your traps as well. So they're involved with the sternocleidomastoid occipitomastoid in moving your head into flexion. And then when you tip your head back, you're using the trapezius on the backside to get that motion. So there's a lot of different things the traps do. If you had a tear in your traps or you had some kind of injury to that muscle, it would definitely affect your ability to move your scapula and move your head. Number 9, the rectus abdominis. The rectus abdominis originates from the pubic crest and the pubic tubercle and the medial half of the xiphoid process. So it originates at the pubic symphysis and it inserts on the ensiform process. So it's the six-pack that you see when people are cut. It's the most superficial muscle of the core and it does several things. It's involved in trunk flexion, so bending over at the waist. It's also involved in trunk extension, so straightening up from that bent position. It's involved in trunk rotation as well as lateral flexion, so bending to the side. And finally, it's a powerful muscle during forced expiration. So exhaling against increased abdominal pressure, such as when you're lifting something really heavy. So if you were to injure your rectus abdominis, you wouldn't be able to bend your trunk forward as easily. You'd probably be bending more to the side because you'd only be able to use the opposite side to bend your trunk. You'd also have a hard time breathing because your core is compromised. Number 8, the biceps brachii. This is one of the most famous muscles in the body. Everybody knows where it is. It's on the front of your arm. It has two heads. It has a long head and a short head. The long head originates from the supraglenoid tubercle, and the short head originates from the coracoid process, both on the medial border of the scapula. And it inserts on the radial tuberosity, on the radius. So its function is elbow flexion, so it bends your elbow. And it's also involved in supination of the forearm. Supination is rotating the forearm so that the palm is facing up. So if you lose the function of your biceps brachii, you're not going to be able to bend your elbow as easily. It'll be harder to flex your elbow, and it'll be harder to supinate or rotate your forearm into that position. So when you lose the biceps brachii, you're basically left with triceps brachii to move your arm, which is really only going to allow you to extend your elbow. And then you're going to be using other muscles to help you supinate your forearm. Number 7, the gastrocnemius. The gastrocnemius originates from the medial condyle of the femur and the lateral supracondylar ridge of the femur, and it inserts on the calcaneus, or the heel bone. It's a large muscle, superficial muscle in the back of your calf. Functionally, its primary action is plantar flexion of the ankle, which is pointing your toes down. It's also involved in flexion of the knee joint, and it's also involved in hip extension. So if you lose the function of your gastrocnemius, you're not going to be able to point your foot down anymore. It's going to be really hard to stand on your tiptoes. Your knee is going to be a little bit weaker when flexing, and you're going to have a harder time going up inclines and even walking upstairs because you're losing a very powerful muscle in your lower leg. Number 6, the gluteus maximus. The gluteus maximus originates from the medial aspect of the posterior sacrum and the coccyx and the medial side of the ilium and the sacrum, and it inserts on the greater trochanter of the femur. The gluteus maximus is the largest muscle in the body, and it is a powerful hip extensor, so it extends the hip joint. So when you're standing and you're bringing your body weight forward onto your toes, you're using your glutes to extend your hips. And it's also involved in lateral rotation of the thigh. So if you lose the function of your gluteus maximus, you're not going to be able to stand up straight. You're going to be sitting in a constant state of flexion. It's going to be hard to climb up and down stairs. It's going to be hard to walk up inclines. So there's a lot of functional impairments that are gonna occur if you lost the use of your gluteus maximus. Number 5, the deltoid. The deltoid originates from the clavicle, the spine of the scapula, and the lateral third of the clavicle, and it inserts on the deltoid tuberosity of the humerus. It's a large muscle. It's a thick muscle. It covers a large surface area on the shoulder, and functionally, it's an abductor of the arm, so it moves the arm away from the body. It's also involved in flexion and extension of the shoulder joint, and it's also involved in internal and external rotation of the shoulder joint. So the deltoid is a very powerful muscle in abduction. It can move your arm overhead to the side without any assistance. So if you lose the function of your deltoid, you're going to have a really hard time raising your arm overhead to the side. You're going to be using other muscles like the teres minor and the supraspinatus to help you do that. It's going to be very difficult to perform a shoulder abduction. Number 4, the triceps brachii. The triceps brachii originates on the back of the scapula on the lateral side. And it also originates on the back of the humerus on the medial side. And then it inserts on the olecranon process of the ulna. It's a large muscle on the back of your arm. It makes up the bulk of your arm on that back side. And its function is to extend the elbow. So if you were to lose the function of your triceps, you wouldn't be able to extend your elbow back. It would always be bent, and it would be very difficult to perform any kind of push motion because you're losing the biggest muscle on the back of your arm. Number 3, the external oblique. The external oblique is one of the most superficial muscles of the core, and it originates on the outer surface of the ribs, from the 5th rib to the bottom of the rib cage, and it inserts on the anterior half of the linea alba. Functionally, the external obliques are hip flexors. So they bring your hip into flexion, and they're also involved in lateral flexion of the trunk, so bending to the side, and they also assist in breathing. So if you lose the function of your external obliques, you're not going to be able to bend your trunk to the side as easily. You're not going to be able to flex your hip as easily. You're going to have a harder time breathing, and you're also going to have a harder time maintaining your balance because your core is compromising. Number 2, the internal oblique. The internal oblique originates on the inner surfaces of the ribs, from the 1st rib all the way down to the last rib, and it inserts on the interior half of the linea alba. Functionally, it does the same thing as the external oblique. It's a lateral flexor of the trunk. It's involved in hip flexion, and it's also involved in trunk rotation. So if you lose the function of your internal obliques, you're not going to be able to bend your trunk to the side as easily. You're not going to be able to flex your hip as easily. You're going to have a harder time rotating your trunk. And again, you're going to have a harder time maintaining your balance because your core is compromised. Number 1, the soleus. The soleus originates on the medial side of the tibia and the fibula, and it inserts on the calcaneus, or the heel bone. Functionally, it does the same thing as the gastroc. It's a plantar flexor, so it points the toes down. It's also involved in lateral rotation of the foot, and it's also a weak hip extensor. So if you lose the function of your soleus, you're not going to be able to point your foot down as easily. You're not going to be able to avert your foot, and you're not going to be able to stand up on your tiptoes. So if you enjoyed this video, make sure you like it and subscribe to the channel so you can be notified every time we upload new videos. Thank you for watching, and see you in the next video.